is now starting. All attendees are in listen-only mode.
Welcome, everybody. This is Renee Crolius, Senior Program Manager at All Chicago.
Hi, friends. This is Stephanie Seidman, Senior Program Manager at CSH.
Thank you all so much for joining us today for the Coordinated Entry 2019 Prioritization Plan. We do have the webinar scheduled for an hour. Stephanie and I are going to go through slides, and we're going to have time at the end to answer any questions you may have. Before we get into that, we want to orient you to the right-hand side of your screen. You have one handout under the handouts drop-down. Also, you have the questions and chat features that you can send us questions through. And as we said, at the end, we will review those questions for you.
So we'd like to start by just running through our agenda for the webinar. First, welcome. We're so very glad you joined us. We're going to go ahead and look at our current Coordinated Entry Prioritization Plan, and then what housing outcomes resulted in the last year in 2018, given that plan. We'll then take some time to look at our system level overview to get a sense of what units and beds are available in Chicago for people to be matched to through the Coordinated Entry system, as well as who is known to be facing homelessness in Chicago. And then we'll go ahead and look at our new prioritization plan for this year and priority populations, including what we anticipate the breakdown by subpopulation of who will be housed given the change in our prioritization. And what we'd love to end with is looking at what next steps that will lead to and your involvement in those next steps and answering any questions that you may have. Just to give a little bit of background about how this change came about, before we had the wealth of data through Coordinated Entry available to us, the Coordinated Access Steering Committee came together and looked at available data and current system goals and determined that the Coordinated Entry system should begin with an emphasis of significantly decreasing chronic youth homelessness. And you'll see as we go through our prioritization plan of what we have been operating with thus far, how that came into place. And so we put together a work group of people from our Coordinated Entry leadership team, as well as other critical voices to represent the youth sector, and called this a prioritization think tank. And essentially, this group of folks looked at a national scan of how other communities, large cities, and in particular cities that experience cold weather like we do here in Chicago, how other communities were prioritizing people for housing and for each housing intervention, as well as we used our own data dashboard to end homelessness, created and administered by All Chicago, and came up with a draft plan. And really the key focus to this plan was to create an equitable path to housing for all subpopulations, including youth, families, and individuals. And then with this draft, we presented our findings to 6 key stakeholder groups to get feedback, and used that really important feedback to finalize the plan of what we'll be presenting to you today.
Great. So as a reminder, our current prioritization, as Stephanie mentioned, really had a prioritization on chronic homelessness and a specific viewpoint of doing chronic youth, followed by families, individuals, and then our non-chronic. We also had tiebreakers, including veterans, our vulnerability index, length of homelessness, and date of assessment. As many of you know, the vulnerability index played a really huge role as a tiebreaker. We set that up to really categorize and measure how individuals could be matched to different housing interventions. And as you continue to see, we've made a few adjustments with vulnerability index. So as Stephanie mentioned, when we were looking through the prioritization, we wanted to take a look back at the data that we had collected from from our rollout of coordinated entry. And so we saw some housing outcomes in 2018. And although we prioritized chronic homelessness, this could be surprising that only 43% of those that were actually housed were experiencing chronic homelessness. And the reason for this on this next slide, if you look at it, we actually have quite a few resources in our system that are targeted mainly for non-chronic. So our most non-chronic youth were housed in our youth transitional housing programs, and most of our non-chronic single individuals that were veterans were housed by our SSVF, or Supportive Services for Veteran Family Provider programs. So you can see that we have a significant amount of non-chronic being housed, but we're also looking, if you look at these charts, you can also see that, and to no surprise, the majority of our non-chronic and chronic population are single adults. And you can also see that our families make up quite a large percentage of our both non-chronic and chronic population. And so this played a role in how we're looking at this equitable path for these three subpopulations: single adults, youth, and families.
And this may be very familiar to you, but just as a friendly reminder, when we say chronic, just to define it, we're referring to households that have experienced at least 1 year of homelessness that might have been continuous in the last year, or it may have been in 4 episodes over the past 3 years. They may have had breaks in their homelessness, but in these past 3 years, it's still, their length of homelessness still added up to 1 year or more. And also that the head of the household is impacted by a disability. And that could be a mental health condition, a substance use disorder, a physical disability, a developmental disability, or they may be impacted by HIV or AIDS. Any one of those. Of course, we know some households have co-occurring disorders as well, but it's both the disability and the length of homelessness that reaches this piece of a household facing chronic homelessness. So just as a reminder of what we mean by chronic and non-chronic.
Great, thank you. So as we were looking at making changes to the prioritization, one or a few of the areas that we really took a look at is our housing inventory in our current system, also our current population as it's reflected on the one list, and of that population, their length of time homeless. So to no surprise, when we look at our housing inventory here in Chicago, this is a breakdown of the units by model type. So we're seeing over 83% of our units are permanent supportive housing. What we also know about that housing inventory is that our permanent supportive housing programs do a really great job of retention, and so we don't see a lot of turnover in those units. Additionally, we have 10% of our housing inventory of rapid rehousing, 3% of youth TH, and 4% fall into the other category. Then when you look at our population breakdown, you're seeing that of our units, we have 51% that are dedicated to individuals, followed by families at 8%, youth at 3%, and individuals and families at 38%. So you're seeing that we have a really high number of units, housing models, and units in our system that are dedicated to individuals. So when we take a look at our housing inventory and compare that to our population on the one list, we're also taking a look at the breakdown again between our chronic population and our non-chronic population. And we're seeing about 30% of people that are experiencing homelessness are experiencing chronic homelessness. And Stephanie did a great job of reminding us of what that definition is. We've put some disclaimers throughout the slides about veterans and how they impact the data as well. And so you can see that we have 715 veterans, and the majority of those veterans are individuals. So the next couple of slides here are pointing out how this breakdown on the one list, it relates to our chronic and non-chronic population. And overwhelmingly, again, you're seeing that 78% of our one list is single adults that are experiencing chronic homelessness. 63% of our individuals are non-chronic. And then followed by youth coming in at 10% of our chronic population, and families at 12%. And this is really important as we're looking at an equitable path towards housing. And then again, we're pulling out some of the veteran information. A lot of times why we're doing that is we have a lot of veteran dedicated resources. And so when we think about our unit inventory, often our unit inventory isn't impacted by veterans being preferenced as they have their own set aside. So we also looked at length of time. So not only what is the breakdown on the one list between experiencing chronic homelessness and non-chronic, but we're also looking at how long have they been experiencing homelessness. And so as Stephanie mentioned, if you're meeting the chronic definition, you already have 1 year, but we know in our system that we have quite a few people that have experienced far greater than 1 year of homelessness. We also, as a system performance indicator, HUD reviews our progress every year on reducing the length of time homeless in our system. And the Chicago COC is scored on this each year about our ability to reduce the number of days. We have been able to reduce the number of days on average between 7 and 10 days each year. However, we would really like to see a greater impact in that reduction.
So what we'd like to talk about next is a few more details around how long people report they have been experiencing homelessness. Because, if your heart fell when you heard we decreased by 7 to 10 days, we assure you our hearts fall with you. We should be decreasing by years, given just how long some folks have been in this traumatic state. So what we did from a data perspective was, using the data available to us, we looked to see how many years has it been for people who are known to be facing chronic homelessness by subcategory, by youth, adults, and families. And the way that we currently collect data as a system, this came from people who are reporting an episode that is this long, as opposed to people who are reporting several episodes. So this is not entirely conclusive, but what was available to us. And what you can see from this is that because some youth are reporting experiences of childhood homelessness, even people who do not appear to be old enough to have 5 years of homelessness do, when counting their childhood experience as well. And that there's a population of adults for whom it has been over 5 years, over 10 years. And we're seeing with families with children, this group in this space of, it's been over 3 years or it's been over 5 years. Some of these families, in and out of family shelters and we're highly aware of through coordinated entry during those experiences. And we've also received a lot of feedback from family shelters about long-term stayers, verifying this time frame that's self-reported as well. And so what we wanted to do with you next is just look at, well, for whom has it been over 2 years? And what you can see from this is that both with youth and families facing chronic homelessness, about a third, it has been 2 years or longer as a continuous episode. And for adults, it's about 2/3 of people known to be facing chronic homelessness have either been in shelter or in a place not meant for human habitation for 2 or more years. So we're starting to think about people meet the definition of chronicity, and also there is a category of people who are really super chronic, and that's what this slide is attempting to demonstrate. The next piece that we want to discuss with you is how we know that people are facing such an experience of homelessness. And in some cases, homelessness can be verified by variety of sources. What we did was we looked to verify homelessness just specifically through the Homeless Management Information System, or HMIS database. And what we found was that 17% of people on our by name registry of folks experiencing homelessness that we call the one list, we could verify that they were underreporting. So just to give an example, if I had been in a shelter for the past year and you asked me, how long have you been experiencing homelessness? And my response was, I think it's probably been 9 months. Then I would fall into this category of 17% of people who are offering a response that's not as great as what HMIS can verify. 25% of people exactly report what HMIS verifies as their experience of homelessness, that they remember very concretely perhaps the crisis that led to the homelessness and the month in which it started, and their project entry into HMIS matches their self-report. And then what you're seeing underneath that is people who report between 1 to 100 or 100 to 200 or more days that's not verified within HMIS. And that doesn't necessarily mean that all of these people are over-reporting. It may be verifiable in other ways, or it is their true story without being able to verify, but simply that HMIS isn't able to capture for those folks the exact experience they're reporting. And so what we wanted to just demonstrate is that over half of the time, only using HMIS and no other verification source, we can prove that people are not over-reporting. And in fact, that some people are, because it's difficult to track time and for other reasons, under-reporting. And so that's what this slide is showing you. That brings us to our new prioritization. And so a lot of the setup here of what we've been discussing has been around length of homelessness. And that's because we're going to prioritize populations based on their length of homelessness. The idea is that people, for example, who are facing chronic homelessness, who have had this experience for years upon years, are in a position where they require permanent supportive housing, regardless of how they may answer questions within an assessment. If they were to have been in a position to self-resolve, they would have self-resolved years and years ago. And so what we're doing is we're creating buckets of years so that our tiebreakers can be meaningful, to say that people between this year and this year are in a group on the one list, and then beneath that, this year to this year. And within each group, we're sorting by our tiebreakers. The first one being unsheltered. So for people who've had a similar experience of years of their length of homelessness, we wish to offer housing to everyone outside first, which has a lot to do with living in a cold city where people's health is at such great risk, and other ways in which staying outside or places not meant for human habitation can cause a person to be more vulnerable. Secondly, we'll prioritize people who've served in the United States military. And this brings in our assumption that we always do match veterans to veteran resources when they're eligible. So the tiebreaker piece would simply be for people who served in the military who are not eligible for any veteran resource, that would be our second tiebreaker. Then we'll use our vulnerability index as the third tiebreaker, but we won't have any categories around VI being associated with any housing intervention. So anyone could be eligible for an intervention based on their experience or their length of homelessness, and then VI is a tiebreaker versus a rule setter or eligibility piece. And our final tiebreaker is people who are impacted by domestic violence. And a quick note about this is simply that people who are fleeing violence may be fleeing partner violence, or they may be fleeing or have fled any environment that was violent. And we've more often seen, for example, with a younger cohort of youth, 18 to 24-year-olds, that their domestic violence experience may not have been partner-based, but certainly would qualify them in this way. We do have a handout that Renee referenced at the beginning, and we'll send this to you as well and post on our website, that breaks this down further. And the slide in front of you is just our way of establishing which intervention lines up in what way. And so since we'll go with people who have had the greatest length of homelessness in terms of our matching strategy for permanent supportive housing, and I should say who are facing chronic homelessness, rapid rehousing will begin with households who have faced 2 years of homelessness or less. And the concept there is that we won't be able with PSH in the next year to reach folks who've faced 2 years of homelessness or less, given how many people have faced more and sometimes considerably more. For transitional housing, this is an intervention that we've discussed that specifically houses youth who are not facing chronic homelessness. So we still will go by length of time homeless, but people are not required to have a disability or 12 months of homelessness to qualify. And even within transitional housing, there's a breakdown because there are 2 programs that have runaway homeless youth dollars that allow those programs to house unstably housed youth with no length of homelessness. So there's a little variation there. Safe havens, and these are programs that have they're entirely low barrier that operate much like permanent supportive housing with more enhanced services and more round-the-clock care, and yet are described as emergency shelter if you were to look at how HUD refers to safe havens. We'll be accepting people who've been assessed by an observational assessment, meaning folks who wouldn't be able to get through a standardized housing assessment and answer questions, who need really just more enhanced supports. And this is a prioritization practice that went into place in December. And so we're not making a change for this particular intervention because this is so new and was created with the safe haven providers. And the other category of housing that we're not changing is permanent housing with short-term supports. That's a very small project in our larger scope. Some of these projects are transitioning to other project types, and so we'll continue to have that program house households who are not facing chronic homelessness using their VI score. And the last really major point of this is that once you start to go by length of homelessness, young people have not lived as long to have had as great of an experience of homelessness in terms of length. And so we've established a 10% set aside for youth, meaning 1 out of every 10 units that becomes available in the system through both supportive housing and also rapid rehousing will be offered to an 18 to 24-year-old facing chronic homelessness in order of their length of homelessness, so that we're not measuring their length against adults who are older, but only as compared to other 18 to 24-year-olds.
I think one thing that is important to think about with the coordinated entry prioritization is that we have a limited number of resources in our system, and that's why we have to have a prioritization. We just don't have enough housing interventions for every single person that is on our one list. And so although that is a separate goal, it isn't necessarily the goal of prioritization. However, the goal of prioritization this time around is we're really, really trying to have an equitable path for all interventions. And so what you can see on the screen is in the middle is the percent broken down by the subpopulations on our one list. So currently we have 12% of our one list is families, 72% single adults, and 15% youth. On the left-hand side, if we did not change our prioritization, this is the projection of how those units, the turnover units, would be filled throughout the year. So we would still we would see that 32% of units would be filled with youth, 64% individuals, and families would only get 4%. This we did not feel comfortable with. When we looked at the new prioritization and using length of homelessness, we got really, really close to being equitable for each path. And so on the right-hand side, you're seeing families make up 11%, in single individuals 70%, and youth 19%. And There's a caveat in there of the veteran dedicated resources for individuals being at 22% and less than 1% of veterans for youth. And so I think it's really important to see that this is getting us much closer to being equitable. Of course, this is a projection and we don't have control over all of the turnover units. So we will be keeping an eye on this data throughout the year. We also wanted to point out when we looked at the data and looked at the tiebreakers, we are seeing that on our one list, 16% are unsheltered, followed by 8% of our one list veterans. Of course, as you all know, the vulnerability index varies quite dramatically by all subpopulations. That data was looked at during this time frame of determining should vulnerability index still play a role. And in the what Stephanie called the roadshow, when we were going out to other work groups, really looked a little bit closer at that vulnerability index and how chronic families versus chronic youth and chronic individuals were scoring lower than you would assume compared to non-chronic, and we didn't feel comfortable using that as our main prioritization without looking into making some revisions. And then, as you can see, our tiebreakers on the one list is 13%. I think this is really, really important for us to acknowledge that the tiebreakers with the new prioritization will come into effect, but it's also not necessarily making a lot of shifts because these percentages are fairly small.
And if you haven't heard the good news, we, as a community, were awarded 2 new projects this year that are specifically for people who have survived domestic violence. One is a rapid rehousing program, and the other fits into the model of the joint transitional housing to rapid rehousing program. So we would expect, because new resources have been made available, that we would see an increase in survivors of DV accessing housing, even in addition to this becoming a tiebreaker.
So we would like to talk about next steps.
Yeah, and this is really where you come in, and thanks so much for listening. If you haven't had a chance to chat in a question or a comment, please feel free to do so now, because after this slide, we're going to go ahead and turn to any of your comments or questions that we can address. And in the meantime, what we're looking at over the course of March and April is that we're updating our coordinated entry assessment. And really that's for 2 reasons. One is that we need to capture better information about people who are unsheltered. For example, are they unsheltered with their children, or are they unsheltered and reporting as a family, but their children are elsewhere? And there are other questions as well that are being modified to understand location. So for follow-up of engagement around people who are experiencing unsheltered homelessness. The other major update to the assessment has to do with how we're capturing length of homelessness. In the past, all we have needed in this category is enough to understand who would meet the chronic definition. And so we've been asking people about the last 3 years. Now that we're prioritizing people based on their length of homelessness and knowing that some people have episodic homelessness, meaning that the last episode may have been for 2 years and there could have been a break, and the episode before that could have been for an additional 2 years or something like this. We need to capture that information. And so our skilled assessors will be hearing from the Center for Housing and Health on upcoming trainings in March around that assessment update, so we can capture this information accurately and then match accordingly. With the new data, we'll be able to implement our prioritization plan, and by data I mean the new information that comes in from assessment updates for households with episodic chronic homelessness. But it'll take a lot more than asking people for how long have they been experiencing homelessness. And so there's 2 pieces that go into this rollout of the new prioritization plan. One is that every household matched to permanent supportive housing will have navigation supports. It could be that the navigation supports that help with things like bringing someone to an appointment or helping with ID or even just discussing housing ambivalence and creative solutions that may help someone try an opportunity or at least voice what they would be willing to try. Those supports may come from an outreach team that the individual or family is already linked to, or a drop-in center if someone is enrolled in a project like this. If they're not enrolled during the matching process, households will be matched both to supportive housing and to a navigator. Our understanding is that people with an extensive period of homelessness all will require this support, so we want to ensure that it's available to everyone being matched to supportive housing. The other piece is that we'll be starting 2 housing system integration teams, one for individuals facing chronic homelessness and one for families facing chronic homelessness. In both cases, housing providers who serve either or both of those populations will be invited if they have somewhat significant turnover or significant compared to others, as well as the homeless crisis response providers who offer outreach, drop-in, day supports or shelter to these folks to really bring these groups together along with housing system navigators to be able to look both at how we can use case conferencing as a strategy to build teams around households matched to supportive housing, and also looking further down the list of who's likely to be matched in the near future to see who's able to continue to outreach to or engage those households and really collect information so that the matches that we're offering are the most appropriate possible. And then what we would love to do is, if you haven't had a chance to chat in, but you want to, please feel free to. If you don't have the opportunity or this isn't quite right for you, the next slide will also show some contact information because we're really delighted to be in touch now and in the future. But we'll just go ahead and see if any questions are in the chat box that we could address. And if you're busy chatting in the question, we're also very happy to patiently wait because we don't see any questions just yet.
Will the PowerPoint be shared?
Yes, that's a great question. The PowerPoint will be posted both on the CES website, which is www.csh.org/Chicago CES. Also on the All Chicago website. Also, we'll send it to you. I mean, we'd be happy for you to share it with anyone. This is to be made available. We'd like for this process to be entirely transparent for the community. Thank you. That was a great question. If anyone else has a question, please feel great about chatting it in. So what we'll do also after this question is we'll keep this open just in case someone chats in a question so that we can chat back as well, even after we close the webinar. But it looks like there's one more.
Do patients with severe mental illness receive priority?
That's a great question. So people are meeting the chronic definition because they have a disabling condition, which in many cases in our community really specifically includes people who have a severe mental health condition. But we are looking at the total length of homelessness. And so we're going by how long have they experienced homelessness. In the past, we've relied much more on a vulnerability index where we found specifically for individuals that people with a severe mental health condition were not scoring very high. The questions are very medically based for single individuals. And in particular for folks with a severe and persistent mental health condition who do not access medical care, they were answering no, they did not have any medical challenges and were scoring low. So a large reason that we changed our prioritization plan was to say, we need to be able to capture that the length of homelessness is in itself a vulnerability aspect that should be honored and responded to. And that would include people with any type of disability. I'll mention just briefly that if you're interested, the flexible housing pool, which is a collaboration between the city, Cook County Health and Hospital Systems, and also bringing on new hospitals and managed care organizations, is bringing a new permanent supportive housing resource to Chicago that's focused on frequent utilization, either in jail or hospitals, and that population tends to also come up as people who are impacted by a severe mental health condition who are qualifying. But for us, it isn't the mental health condition that advances someone. It's more a factor to be considered for matching. For example, if the chronic single system integration team says this person needs this type of supports, we may need to look to an agency that we understand has a program opening that would support that person appropriately. So it's more of a consideration once they have been prioritized for what would be the best match.
Great. So yes, please feel free to continue asking any questions, but we will end the webinar. And thank you so much for your time. If you have other staff that you would like to come to and learn more about this, we are having an in-person training at All Chicago next week, and that can be found in both the Coordinated Entry newsletter and also on the All Chicago training website. Otherwise, thank you so much for your time today, and we'll see you soon.